the day shift nurse?
Yeah, what's up?
Do you have Miss Fisher or Mr. Peters? Okay, well those are my patients and I'm trying to get out of here, so let's give their report. Alright. Hey girl, I'm so tired, so let's just try to get this over with.
Okay.
Your first patient will be Miss Fisher. She's completely disgusting. She keeps refusing a bath and smells terrible. She had a THR yesterday morning and refuses to get up. She has a history of diabetes, hypertension, and osteoarthritis. She's taking insulin, Prinavil, spironolactone, morphine, and Lovenox. She has a Foley, so you'll probably have to remove that sometime today. Ready for the next one? Your next one will be Mr. Peters. He loves his pain meds and will ask you for them every time you're in the room. He was admitted with gangrene on his right foot. His foot was chopped off about 2 days ago, so I completely understand why he wants more pain medication. He also has uncontrollable diabetes, and his medications are insulin and morphine.
Hi, girls.
Hey.
Okay, so my daughter is going on a mission trip, and she is selling these little monogram t-shirts. They'll have like your initials on the pocket, and they're super, super cute, and they're pretty cheap. They're only like $25. Would you guys be interested in buying one from her?
Yeah, I've always been wanting one of those. Do you have anything I could try on today?
I do, but they're in my car. Can you wait?
Yeah.
Okay, I'll be right back.
Thank you.
All right, now that she's gone, what can we get back to this so I can leave?
Yeah.
All right, where was I? You'll just figure it out.
Hey, Jesse, I have Miss Fisher and Mr. Peters. Do you have either of them?
Oh yeah, I have both of them. Are you ready to get report?
Yeah. Do you want to go over by their bedside?
Yeah, let's go. All right, so Miss Fisher's gonna be your first patient today. Let's go ahead and go to her room and get report. Good morning, Miss Fisher.
Good morning.
This is Mackenzie. She's going to be your nurse today. I'm just going to let her know how everything is going with you. Do you mind if we just give report right here?
No.
All right. This will just give you a chance to ask questions if you have any, and just to let you know what your plan of care will be for today. Like I said, this is Miss Fisher. She's 65 and had a total hip replacement yesterday morning. She has a history of diabetes, hypertension, and osteoarthritis. She's taking insulin, Prinavil, spironolactone, morphine, and Lovenox. She has a Foley in, so we're probably going to go ahead and remove that today, Miss Fisher, so that you don't get an infection. She hasn't been able to get up, so we need to work on that today. Does anyone have any questions so far?
No.
All right. We'll probably need to go ahead and look at her IV. How's it feeling this morning?
It's okay.
All right.
Looks pretty good. Do you have anything else I can get you before we step out?
Banana.
Okay, I'll put
All right. Do you have any other questions about Miss Fisher?
Yeah, I noticed something, but I didn't want to mention it in front of her. I noticed that there was a bit of an odor in the room. I couldn't tell if that was coming from her or if it was something else in the room.
She has been refusing her bath, so maybe you can try to convince her to take a bath today.
Okay, I'll talk to her about that.
She also hasn't walked since her surgery. Every time I've asked, she's refused, so really try to encourage her to get up and get moving. That way she can get discharged as soon as possible. And also, after you take the Foley out, make sure to check on her and make sure she's going to the bathroom, and that'll also just be an excuse to get her up and walking.
Alright, I think that's it. Let's go talk to Mr. Peters.
Alright, your next patient is Mr. Peters, so let's just go ahead and go into his room. Good morning, Mr. Peters. This is Mackenzie, and she's going to be your nurse today. Do you mind if we just give report in here this morning?
No.
Alright, this is just a good time for you to be able to ask questions. If you have any, just pop right in and ask. And also, this is just a good time for us to inform you on all your care you'll be getting today. Alright, Mackenzie, like I said, this is Mr. Peters. He was admitted with gangrene on his right foot about 2 days ago, and he did have it amputated at the ankle. Mr. Peters, can you rate your pain on a scale of 0 to 10 for me? 0 being the least pain and 10 being the worst pain you've ever had.
It's a 9.
Where's it at? Can you tell us?
It's in my right foot.
Okay, I'll make sure and check your doctor's order to see if you have any pain medication ready.
We've been treating him for his surgery pain and his phantom pain. He has been getting IV morphine as needed, and he also has diabetes and is taking insulin for that.
You forgot to tell her that I'm supposed to be able to walk in the hall today.
Oh, thank you, Mr. Peters. Yes, he needs to walk it to the end of the hall and back with crutches. So make sure to help him with that. Also, when your wife gets here today, we're going to go ahead and teach her how to change your bandages so that she knows how to do it when you get home.
Okay. Sounds good.
All right, Mr. Peters. Mackenzie will be back in a little bit. Is there anything else we can get you right now?
That medicine.
All right, we'll check on that for you. Did you have any questions about Mr. Peters?
Yeah, do you know when he might be discharged anytime soon? I just wanted to make sure that I teach his wife about wound care before they leave.
Yeah, his surgery was 2 days ago, so he'll probably be getting discharged either today or tomorrow. So I would say your best bet would be try to teach the wife today. And also make sure you check his blood sugar before his breakfast since he is a diabetic. We want to make sure his glucose is in the right range. So.
Okay.
Would you look at that? I'm out of here right on time.
Mm-hmm.